I am Dr. Mathew Abraham. I am a senior consultant neurologist at Aster Medcity, Cochin. Today is stroke day. It's very important that you should recognize what a stroke is. Essentially, it is the blockade of a blood vessel to a part of the brain, as a result of which that particular part of the brain doesn't function properly, leading to a paralysis of a corresponding part of the brain of the body which it controls. It can also result from the rupture of a blood vessel which produces a hemorrhage. This is usually due to high blood pressure. What is important is that everybody should know about the symptoms of stroke, and this is best done by remembering the acronym FAST, F-A-S-T. So F is for face. If there is an asymmetry of the face or a slurring of or a deviation of the angle of the mouth which comes on suddenly, then that is possibly the beginning of a stroke. A is for arm. If there is a sudden decrease in the power of the arm or a clumsiness of the arm or a sudden numbness of the arm, then that can also be the beginning of a stroke. S is for speech. If there is a slurring of speech, difficulty in speech, as a result of which the person cannot speak properly, then that can be the beginning of a stroke too. And T is the most important part of it. If you recognize a stroke happening, it is vital that you should get this patient to a hospital as quickly as possible. The importance being that within the golden period of 3 hours, if you are able to intervene in a stroke, you can salvage the patient's strength and therefore reduce the morbidity of a stroke. What is new in stroke is that this golden period has resulted in interventions which have changed the entire outcomes of stroke. This particular procedure is known as thrombolysis, and it is important that it should be done within the golden period of 3 hours. After that, you have new interventions that are possible in certain specialized hospitals, and these are known as using catheters, which can actually be maneuvered to a point beyond the compression or the stroke, and the clot can be pulled out. Even that has a time window, and that is about 6 to 8 hours. So the most important thing to remember is recognize a stroke for what it is, get the patient to the hospital in that period, and you will save the patient's life or improve the quality of his life subsequent to the stroke. What is also important is the fact that recognition of high blood pressure, diabetes, heart disease, obesity, smoking, these are all factors which are risks for subsequent strokes. It's important to recognize them in time, treat them appropriately so that the chances of your developing a stroke becomes less. Thank you.